Imagine this, somewhere deep inside your brain, there is a weak spot on the brain blood vessel. And over time, this bulges out, causing a small balloon that is inflated on the side of an artery. Most people who have this aneurysm may not know that because it is asymptomatic in most of the situations, means there won't be any symptoms. But in rare cases, it tends to rupture or burst. So in such cases, if it does, it is a life-threatening emergency. This is a brain aneurysm. In the next 10 minutes, I'll walk you through all about brain aneurysm, why the brain aneurysms are formed, who are at risk, how we diagnose, what are the warning signs to watch for, and what are the treatment options available that save lives, and if they are available, how safe they are because they have to deal with the brain. Let's dive in. So a brain aneurysm is essentially a weak bulging area on the wall of brain blood vessel. Think of it like this. Imagine a car tire with a weak spot. As you drive it, the air pressure inside the car tire tries to push the weak spot, and over a period it tends to bulge out to form a significant bulge at the thinned area. Essentially the same thing is happening inside your brain blood vessel at the weak point. Most aneurysms form at the branching points of brain blood vessels. Reason being that these are the areas that naturally have more stress when the blood flows across them. So over a period of time, that particular branching point, because of the stress, it weakens and may produce bulge outwards or the brain aneurysm. So here is the important part. Most aneurysms never rupture. Many people live their entire life with small stable aneurysms without any problem. If the aneurysm does rupture, it may produce something called as subarachnoid hemorrhage or bleeding around the brain, around the water in the brain. If it happens, it is a life-threatening emergency. So why do brain aneurysms form? The brain aneurysms do not form overnight. They gradually grow because of a combination of factors or reasons. So the first of these combination of factors is structural weakness in the brain blood vessel wall. So some people are born with naturally weak blood vessel walls. It's not something you did wrong, but the build is like that. So the second factor is chronic high blood pressure or hypertension. So the chronic high blood pressure is like overinflating a car tire, which may exacerbate the bulge formation at the weakest point. So over years or decades, what will happen is that the weak point tends to grow more faster as compared to normal people, and that may tend to rupture also. So the third factor is smoking. Smoking causes damage to the inner lining of the brain blood vessel, which significantly increases the risk of brain aneurysm formation. This I can say the most important preventable or modifiable or controllable risk factors out of all brain aneurysm risk factors. Fourth one is genetic disorders. Certain inherited conditions like connective tissue disorders make the brain blood vessels more fragile, and thereby they make the blood vessels more prone for the aneurysm formation. So the fifth one being family history. Yes, you heard it right. The brain aneurysms can run in families. If you have had 2 or more close relatives who had aneurysm, there is high chance that you may have an aneurysm. So there is a role of screening in this subset of patients, and genetics plays an important role here. The other contributing factors include age and gender. So aneurysms we see more commonly in patients who are 40 years or more. Regarding the gender, we do see commonly the aneurysms in female population as compared to men. So we do get to ask by the patients and their attendants whether the aneurysm is related to any emotional stress or mental stress or any previous trivial head injury. Usually these are not the causes. So these aneurysms form and grow slowly over years or decades together to produce symptoms, or if they rupture, it is usually over years together rather than overnight. So regarding the symptoms, what to watch for? Here is the most tricky thing, that most unruptured aneurysms or aneurysms which are not ruptured may not produce symptoms at all. So how they are diagnosed then? They are diagnosed when we do a CT scan or MR angio unrelated to some other symptom like headache or a trivial head injury, and you got the scan done, and incidentally you got to know that an aneurysm is present. Having said that, the larger aneurysms can cause some symptoms due to the compression on the surrounding nerves or structures. The symptoms are headache, drooping of eyelid, double vision or completely impaired vision, and facial twitching or sometimes imbalance. So these are all the symptoms of unruptured significant sized aneurysms. That is about the unruptured aneurysms. So what about the ruptured aneurysms? So once the aneurysm ruptures, it produces classical signs and symptoms, which can be headache, which is described as thunderclap headache, nothing but described as worst headache of the patient ever observed. Apart from that, patient can have loss of consciousness, fits or seizures. If you or someone near you have these symptoms of ruptured aneurysm, immediately take emergency medical help. That can be life-saving if done timely. So how are the brain aneurysms diagnosed? Brain aneurysms are diagnosed by imaging. And there is no blood test or physical test, physical examination that can diagnose the brain aneurysm. So what are the imaging tests available? The imaging tests are CT scan with CT angiography, MRI with MR angiography, and DSA. In CT scan, we can detect bleeding. Subarachnoid hemorrhage present or not, we'll come to know. Whether the aneurysm is ruptured or not, we'll come to know. CT angio, in which we additionally give contrast or dye, which lights up the brain blood vessels, and we'll get to know the high quality information about the brain aneurysm morphology, and sometimes it can help in further treatment planning. And regarding the MRI scan with MR angio can be done without giving a dye, without giving an injection, and it is most commonly employed investigation of choice in case of unruptured aneurysms. Regarding the DSA gold standard for detection of the aneurysm and treatment planning also, which is a bit minimally invasive but more invasive as compared to CT angio or MR angio. And in this test, we do insert a small catheter through the hand or leg to navigate it to the neck region and take videos of the entire brain circulation after injecting the dye. In DSA, we have something called as 3D rotational angiography, and it is the modern form of angiography where we get to know all the information about the brain aneurysm, and smallest of brain aneurysms like up to 0.5 mm can be detected in it. And because it is of very high resolution, we get to know both the aneurysm morphology, means the what kind of structure it is, and we can plan the treatment also based on the information available. So it is very safe, reliable, and gold standard form of detection of the aneurysm. So when do we treat aneurysms? Not all aneurysms require emergency treatment. In fact, many of these aneurysms are followed upon imaging or scans. We make treatment decisions based on several factors. So the most important factor is size of the aneurysm. Small aneurysms, which are less than 5 mm in size, have very low risk of future rupture. So they can be simply watched and followed upon following imaging or scans. The second one is location of the aneurysm. There are certain locations like which are deep inside the brain, the ACOM location or the ICA bifurcation or the MCA bifurcation, PCOM location. So these are certain locations that we take into account before deciding upon the further treatment options. So third one is the growth of the aneurysm. If on serial scans the aneurysm is getting bigger, that is alarming, and that prompts definitive treatment, especially in young patients. The fourth important factor is family history or personal history. If there is family history of ruptured aneurysm, or if the patient is having previous history of subarachnoid hemorrhage or ruptured aneurysm, this is a definitive indication to treat an aneurysm that is incidentally detected in a given patient. There are other patient-related factors like age of the patient, younger the age, and good overall health are indications for lowering the threshold for treatment. So what is the guiding principle of treating the unruptured aneurysms? It is basically risk of treatment versus risk of rupture of aneurysms. If the risk of treatment is lesser as compared to risk of aneurysm, definitely it indicates treatment in a given case. So coming to treatment options, we have got two treatment options if treatment is indicated. One is surgical or open technique. The other one is endovascular technique or minimally invasive technique. In the surgery, there is a technique called as clipping is done, in which a tiny metallic clip is applied across the neck of the aneurysm to completely seal off the blood flow into the aneurysm. So what are the advantages? It is very durable treatment. The long-term results are very good. And what are the disadvantages? The disadvantage being that it is an open surgery, number one. Number two, the recovery time is a bit longer as compared to endovascular methods. The second treatment option is endovascular treatment or minimally invasive treatment. There are several techniques in endovascular treatment, and what is basically done is a tiny catheter is inserted either from the wrist or the groin, and under fluoroscopic guidance, it is guided right up to the aneurysmal level. And then the treatment is done by using either metallic coils or stents or combination of the both. If you wish to go into further details of the various treatment techniques in endovascular procedures, there are coiling, stent-assisted coiling or flow diverter placement. In the coiling, basically a soft platinum coil is inserted through the microcatheter to fill up the entire space within the aneurysmal sac, so that the blood supply into the aneurysm or the rupture point is completely sealed off. So this is called as endovascular coiling. The second one being stent-assisted coiling. In aneurysms which are having wide mouth or wide neck, the coil may not hold there. So to provide a scaffold across the neck of the aneurysm, a stent is placed and coiling is done. So this is called as stent-assisted coiling. So the third of endovascular treatments is flow diverter placement. Basically, the flow diverter is a stent with a thick mesh. So once it is placed across the neck of the aneurysm or the mouth of the aneurysm, it diverts flow away from the aneurysm into normal circulation. So over a period of time, the aneurysm shrinks in size and a normal natural endothelium is formed across the aneurysm, promoting natural healing across the wall where it is weak. So this is called as endovascular flow diverter placement. It is very useful for unruptured aneurysms and dissecting aneurysms at certain locations. So all these endovascular techniques are remarkably advanced, and they have got the advantage of rapid recovery. Most of the times the patient walks on the next day and will resume his work within a week, especially in case of unruptured aneurysms. So this is basically the advantage of endovascular techniques as compared to open surgical techniques. In many centers who are doing high volumes, the majority of the aneurysms are treated endovascularly. The most important question, most probable question that we have been asked by patients is that how safe are these treatments and how risky are these treatments? So the good news is that the modern aneurysm treatment is very safe, especially if it is done before the rupture. You may be surprised to know that the complication rates, especially in unruptured aneurysms, in experienced centers, it is very low. So for in unruptured aneurysms, the latest technology allows us to have the least complication rates as compared to what we have used to see probably 10 years before. And in ruptured aneurysms, the treatment goal is basically to prevent further bleeding or rebleeding, and the treatment outcomes basically depends upon the patient's baseline condition like consciousness level and other factors and extent of bleeding. So it is multifactorial, the outcome wise. Whereas in unruptured aneurysms, if the treatment goes well, if the particular procedure goes well, the outcomes are very good. Over the past decade, we have seen so many advances in the stent design, catheter technology, imaging, post-operative care, so that we are seeing more and more better outcomes than what we used to see 10 years ago. Thanks to these advances, now we are able to treat aneurysms that were considered very risky to treat just 10 to 15 years ago, that we are now treating very safely with very good outcomes, safety outcomes. So to conclude, what are the preventive measures and what are take-home messages that we learned from this video about brain aneurysms? The first one being, the brain aneurysms are more common than you think, although the rupture is very rare. So what are the most important steps to protect yourself from an aneurysm rupture? The first one being, the most important one is monitor your blood pressure and strictly control the blood pressure if you are a diagnosed hypertension patient, with regular consultations with the doctor and regular monitoring and preventive lifestyle measures which are applicable to BP management. Second thing being, quit smoking if you are a non-smoker. This is the most important modifiable risk factor. So the third one being, if you are diagnosed with aneurysm, no need to panic. Consult your doctor and stick to your imaging schedule if you are on follow-up. Remember, if you ever experience sudden severe headache or thunderclap headache, that is completely different from what you have had before, consult the doctor on emergency basis. Don't wait. It can be an aneurysmal rupture. With the available modern diagnosis and treatment methods, most brain aneurysms are treatable with very good outcomes if they are done early and managed properly. Thank you for watching. Stay informed, stay proactive, stay healthy, and take care of your brain health. Thank you.